morning show. Joining me now is Dr. Zell Cragdon, who is the medical director at SpaMedica here in Toronto.
Morning, Liza. Thanks for having us.
Great to have you on. Thank you, ladies, all for being here. So what we're talking about is hair removal, and this is still, we're talking about Botox, we're talking about fillers. This is still the most popular.
In terms of cosmetic procedures in North America, laser hair removal is #1. It's above Botox, it's above liposuction in terms of number of procedures performed per patient.
Okay, years back I had some laser hair removal done before I had kids, and it worked very well, but it was a little ouchy. You felt the zap.
Definitely.
Is that changed at all?
Technology has changed dramatically in the past decade. The new techniques are less painful, quicker, and much more effective in terms of amount of hair removed.
Okay, so what do we have here?
So in terms of technologies, there's 3 different wavelengths that we use at our clinic. There are some diodes, some alexandrite lasers, and then some other ones called YAG lasers. And essentially what they do is they work at different depths of the hair follicles, different color of hair follicles, and curly versus straight hair follicles.
Okay.
So when you're demonstrating this here, the advantage in the older techniques, it took half an hour per leg. With this technique,
wow, hello.
Exactly. We're looking at 4 to 5 minutes per leg. Much quicker treatment.
That's incredible. And then how many sessions?
Generally 4 to 6 sessions, depending on the person and how much hair follicular concentration they have.
And this time, you didn't know this, but I was watching your face to see if you grimaced at nothing.
That old elastic band snap is pretty much gone.
Wow. Now, is this only for legs? You can use this underarm. You can use
pretty
this
much
bikini.
Anywhere in the body. Anywhere you want laser hair reduction, this laser can be utilized.
Do you have a tan right now?
Yes, I do.
You do. So can you do it on tan skin?
You can do it on slightly tan skin.
Okay.
Tan skin where it's already flaking and actually blistering, definitely not.
Okay. So this kind of laser would be recommended for?
Pretty much any skin type. So the older laser types have to use very light skin, called Fitzpatrick 1 or 2, very white skin. Now pretty much all skin types you can use it on. Middle pigmentation, even dark pigmentation.
Okay, what do we have behind us here?
So this is one of our other laser wavelengths. And really at the clinic, when we book someone for 5 or 6 treatment sessions, they're going to be exposed to all 3 different lasers, again, to target the different chromophores, different lasers, follicles.
Okay,
so looking at this here,
bring this one out?
We'll bring this right around. And Claudia is going to show how we're going to use this here today on Rebecca.
All right, so this is different how than the first that we just saw?
This one's going to target a darker hair follicle and a bit of a deeper hair follicle.
Okay. And that is the thing. Can you target on darker skin with any laser now? Because that was always a
The newer
trick.
lasers are much safer in darker skin tones. You still need to be cognizant of it, and you still need to be very safe with it, but definitely can be used in darker skin types quite effectively.
Still watching your face, not even a twitch.
Much better. Much better.
Yeah, clearly it's way easier now than it was before, and so much faster. This truly now is lunch hour kind of stuff.
You're in and out within half an hour, definitely.
That's incredible. And then after the 4 to 6, gone completely?
About 80% laser. I call it not laser hair removal, laser hair reduction. Probably about 80% in the average patient.
Okay. So, I mean, that's nothing then.
It's quite good.
It's almost nothing left. That's incredible. I am so impressed. What kind of price are we talking about for this kind of thing?
For a small zone, generally $200 to $300. That would be an armpit, bikini line. Large area, let's say a leg in a female, $300. Full back per session. Full back in a male, looking about $300, $400.
I'm glad you brought that up because men are doing this as much or more, aren't they?
I would say about 10% of our laser hair patients are men. A good friend of mine built a pool. He had a very hairy back. At the age of 41, Jamie went in and had his entire back done because he felt self-conscious with his new fancy pool.
I know a lot of guys who get their back waxed because of the same thing, and then this is permanent. So what would the difference be? Like, do people still even do electrolysis?
It still is done. It still is done. I'd say it's a little bit more old school. It's more painful, risk of burns, and the hairs do grow back.
Okay, and then this final machine that you can just tell us about back here.
This is another one of our devices. This is often used for the last session to try and get rid of some of the finer hairs, thinner hairs, to really get rid of those fine ones as best as possible.
Okay, and I know that when people hear laser, they think radiation.
Totally different. So in terms of the physics of it, laser does not expose you to any UV radiation nor any true X-ray type radiation.
Terrific. Thank you so much, Dr. Zell Cragdon. He is the medical director at SpaMedica. Thank you all so much. Great to have you here.